I think one of the challenges, though, is even enabling nurses to think that they have that voice in built environment and design. A lot of the times they're the most creative people, and they know that building more than anybody. We spend 12 hours a day, more than that on a shift. They know every crack in the wall. They know every slip on that floor. But one of the things that I've noticed, especially in low resource environments, is that they actually shy away. They don't consider themselves users because they don't consider how the environment actually affects their work until we actually show them that it's impactful. So one of the things I think that we really focus on, especially in low resource, is actually doing a day -1 evaluation of the culture, of about how the environment actually affects those nurses and providers, but also as community members, their patients there too.
Yep.
So sometimes we call it having this out-of-body experience and looking again as a patient, and then kind of telling us and being able to tell that story.
Yeah.
So that's one of the things that I think really helps to have that clinical voice, is actually enabling that voice and training them in how to appraise the built environment so that they can be really good user groups.
Yeah.
Well, that's
Good point.
because they just don't know. They're nurses and doctors and environmental service workers, and they're not architects and designers and engineers, just like the engineers and the designers are not nurses or doctors. So I think there's an educational component. I mean, I'm always amazed when I go into a user group and I've got a lot of high-powered people, the chief of staff, and they're really kind of shy.
Yeah.
Even though they're muckety-mucks in their own field. So, I think we have an opportunity through NIHD to educate designers around the healthcare industry and to educate nurses and clinicians around the design industry.
Yeah, there's this innate vulnerability, I think, that comes around that change in environment. And I think that's something that as clinicians, we're very uncomfortable with that, not understanding or knowing. So I think that's another part of education, is being comfortable with vulnerability.